Hi everyone, it's Dr. Isabella Jones at McLean Dermatology, and in a couple of moments I'm going to start a Fraxel treatment on my face and my neck. So I've really noticed that in the past couple of years I've developed little fine lines, especially underneath my eyes. And this is despite the use of Botox and fillers and a really good skincare routine. Sometimes those lines just need a slightly stronger treatment. So I will show you kind of what I look like afterwards. I've had numbing on my face for about an hour now, so I'm gonna get started. Hi everyone, it's Dr. Jones again, and I just finished my Fraxel treatment, and it was painful, even with 1 hour of numbing, but I was able to get through it, and I think the results will, of course, be worth it. I'm already looking pretty swollen. My face feels like it's just really badly sunburned, and so I'm going to be icing, applying some good moisturizer, and I'll be sleeping a little bit elevated tonight. Hi, it's Dr. Jones, and this is day 1 after my Fraxel treatment. So the rest of yesterday, I did feel like my face was on fire, but by the time that I went to bed, that feeling had resolved, and I actually slept very well. This morning, I looked more swollen, which is expected, and then my face just feels really a little bit tight. When I washed my face this morning, I used cool water because anything warm did kind of irritate my skin a bit more. I used a gentle cleanser and applied a thick, rich CeraVe moisturizer, and I followed that with an SPF 50 mineral sunscreen. I did go for a walk already today, and I'm just being very careful to protect my face. I wore a wide brimmed hat, wide sunglasses, and a scarf to cover my face and my neck. Hi, it's Dr. Jones, and this is me 48 hours after my Fraxel treatment. And today the swelling is really almost gone. What's really different is the texture of my skin. So it's feeling really rough and a bit crusty, especially around the mouth where I use slightly higher settings there. So I'm not in pain, just a little bit itchy, and trying to moisturize as much as I can. So I'm applying moisturizer basically every 1 to 2 hours. Hi everyone, I'm about 72 hours from my Fraxel, and today my skin feels rough and very crusty, especially around my mouth. So if you look really closely, I have kind of this dead skin here, and my lotion is actually catching onto it, and it makes it difficult to spread. I feel like kind of taking the stuff off, but my biggest lesson for patients is that during the stage, you cannot pick off that dead skin, because if you do, you can lift off some normal skin with it, which can lead to a wound and then potentially a scar. So I'm just moisturizing all the time to kind of keep my skin from feeling too tight. Okay, this is me about 4 days or 96 hours since the Fraxel treatment. I'm looking extra rough because I just put my kids to bed, so it's been a long day. But today's been really a day of peeling. So as I've been putting lotion on throughout the day, little flakes of skin have been naturally coming off. I'm not rubbing them, but that has helped quite a bit with that feeling of tightness. My face really no longer feels tight. And I think that in the next, 24 hours, most of that little scale, and you can see it kind of up close, I think most of that will have fallen off. And then I'll be back to wearing some makeup. All right, we'll see. Okay, this is day 5 after Fraxel, and I'm nearly done peeling. There's a couple of tiny areas of skin that still need to go. But today I would feel very comfortable applying makeup on and going back to work. So if I had done this on a Friday, I would take Saturday, Sunday, Monday, and Tuesday off and feel really fine seeing people on that Wednesday with some light makeup. You might see that some of the areas are still a little bit pink, and that's very normal. Those are the areas where I had the highest settings of the laser, areas where I needed the most collagen stimulation. So those will likely stay pink for another week or two, but they are very easy to cover with makeup at this point.